Hello, everyone. Good morning, and a very, very warm welcome to all of you at the second day of the India Conference at Harvard 2016. We have a very exciting lineup of events planned for you, and I hope you enjoy your time here today at the Harvard Business School. My name is Shashank. I'm a second-year MBA student here at HBS, and it is my distinct pleasure to introduce to you the opening keynote for the day, titled "The Dichotomy Disrupted: Equitable Healthcare for a Healthier India." It is ironical that India, even with its world-class doctors and research and healthcare IT backbone, grapples with the issue of healthcare accessibility and quality. Disrupting this dichotomy of India's healthcare industry is an immediate priority for the country. To share with us her thoughts on India's unique healthcare opportunities and challenges, we have amongst us today Dr. Preetha Reddy, who is one of the pioneer businesswomen of India in the healthcare industry. Dr. Reddy is a vice chairperson of the Apollo Hospitals, which is the largest healthcare conglomerate of India. In addition to her responsibilities at the Apollo Group, Dr. Reddy serves on the board of Medtronic, works with the government to advance policy decisions on healthcare issues, and was a founding member of the National Quality Council, an organization that created the guidelines of quality standards for Indian hospitals. Dr. Reddy is a member of the India-US CEOs Forum, which is a think tank created by the Honorable Prime Minister's Office to strengthen bilateral cooperation and trade. She is also nominated member of the Council for Scientific and Industrial Research. So without much further ado, please join me in welcoming our opening keynote speaker for the day, Dr. Preetha Reddy, to the stage.
Namaste. It's, as always, an honor to be at the Harvard Business School. Harvard Business School, of course, has been aspirational. Many people of my generation probably never even dreamt of coming here. But what has been exciting is that, over last evening and today, I've been speaking to a lot of, I must say youngsters, but a lot of students who are at the business school, and I keep asking them this question. And I said, you're enjoying yourself? And they say, of course we are, and it's such a great experience. And then the second question is, would you think about coming back to India? And 80% of them are saying, of course, we're here because we want to learn, but we're definitely going to come back to India and do something, which I think is really what today is all about. 67 years of independence, we just celebrated our Republic Day, and a very famous patriot said, when we got independence, that independence is no doubt a matter of joy. But let us not forget that this independence has thrown on us a greater responsibility. With independence, we have lost the excuse of blaming the British for anything going wrong. And if hereafter, if things go wrong, we've got nobody but ourselves to blame. There is a greater danger of things going wrong, and times are fast changing. And I think this is probably a fact which most of us have to be aware of, that it's so easy for us to say that, it's the government's responsibility, it's XYZ's responsibility, it's a complex environment, the politics of India is so complex that nothing can change. But I think we have seen over the past 10, 15 years that disruption is actually possible, progress is actually possible, and that goes back to why that 80% of you actually answered saying that, I think we want to come back and do something in India. So, for me, it was quite heartwarming, because I know for sure that if I had been, at my time, a student at HBS, I may not have wanted to come back. And it was the courage of Dr. Reddy, my dad, who came back leaving a great practice in the US. He was a cardiologist and said, no, I need to come back because his father said, nobody will realize if you're a successful cardiologist in the US. But if you come back and do something in your country, then the rest of the world will, come back and say that at least in one sphere of activity, you've made a difference. So in the early 70s, 1970 to be exact, Dr. Reddy moved back with his wife and all of us. And he sold his car, started his little practice in half a room in Chennai. But he was passionate about what he's doing. And in the 80s was the beginning of the Apollo hospitals. And at that time, legislation was not really conducive to borrowing from the banks, and legislation had to be changed. And today we have private equity funding healthcare enterprises. So in 32 years, so much has changed. And this has happened in every sphere of activity in India, and that's really where I'm coming from, trying to tell you all that, things are changing, things are exciting, and if you take the cell phones, for example, we've actually leapfrogged the rest of the world. What we have in terms of accessibility and technology in that space is far better than so many other countries. Similarly, in the healthcare space, it's possible. It's not there today, but it is possible, and I'm going to talk about that as we go along. The long-term macroeconomic forecast, the key trends of 2050, they say that India will be alongside China and the US and dominate world economics. And it's possible, but I think we need to play our cards right. How much of that is in place now? I would say on a scale of 10, we're probably just a 4.5. But if there's a concentrated effort on trying to see in each area of activity, if we do things right, by 2050, I think, India will definitely be among one of the leading countries. Again, the spending power of the average Indian is just 3%. And that of the US citizen is about 24%, they say. And hopefully, again, it will increase in India. The economics of healthcare is, I think, something which all of us have to be aware of, because we know that if there's a very clear investment into healthcare, then there is an economic advancement in the country. Most governments don't really focus on that, and that is probably one of the reasons where healthcare in India is like this huge paradox. You read about it so often, but it's something which really exists, and that's probably something which is there for discussion, and it's something again which is a possibility for us to look into the future and make a difference. Some of the statistics of India, of course, is pretty grim. 1.5 malnourished children in the world live in India. The country ranks 112 out of 190 countries on the crucial parameters of the non-communicable diseases. The healthcare infrastructure, again, is way below the WHO standards, and there is so much we need to do in that space. One key factor, again, is the out-of-pocket spend, which is the highest for any country in India. 86% as compared to an average of about 40% for low-income countries. And rural India lags even further behind, with around 30% of the rural population having to travel 30 kilometers for treatment. In my career in healthcare, of course, I've been really lucky to have a ringside view. And we have seen how private sector healthcare has really made such a huge difference today. The combined market cap today, because we've had 2-3 companies going in for an IPO, the combined market cap today of the healthcare companies is around $5 billion USD. But the potential for it to grow is 3 times in the next 5 years. But again, we have to do many things right, and I'm hoping that with support from the government, because today for the focus on healthcare is not yet there. But it still is a new government. They've probably been just 2 years here, and there's so many initiatives which are coming in. A lot of focus into manufacturing, make in India. You heard the IT minister, and you've heard all that. We haven't heard yet about healthcare. But having said that, then there's a huge opportunity for growth, and that's really what it is. There are huge, huge challenges, and the dichotomies are something I think we need to be very aware of. There is an India and there is a Bharat. The India has fantastic islands of excellence, typically in the cities, doing, benchmarking themselves on the best healthcare companies, typically in the US and the UK. You have cardiac surgery, similar outcomes, cost of surgery, 1/10 of the cost in US, numbers which are mind-boggling in each institution. But then you travel 50 kilometers outside the cities, outside these islands of excellence, and even good, clean drinking water becomes a challenge. So the dichotomy and the paradox of India is there. People pay out of pocket for healthcare. People can afford to go abroad for healthcare. But again, a lot of them can't even afford basic healthcare. The insurance penetration has been exactly 30% at this time, 30 to 33%. Dichotomy, but a huge opportunity for the future. So that is there. We have today some of the fanciest high-end birthing centers throughout the country, private sector, private enterprise. But what we see on the other side is that the infant mortality rates are the highest. So what can we do to bridge these gaps? What do we do to bridge these dichotomies? It's strange, but we have patients coming from 120 countries to India. This medical tourism, healthcare tourism is growing, and it's growing at a rate of about 20-25%. But people coming from the villages into the cities for healthcare, that hasn't grown. Now, if you ask me why, I think a lot of things have to be done to see that, are we ready, are we there to provide access? So I think the dichotomy, the paradox of Indian healthcare, the contrast, those are huge. But having said that, we can look at it and say, okay, the cup is half full, or we can say it's half empty. I think it's up to all of us to see that, can we look at it as an opportunity? Can we look at it as a challenge and try and bridge that gap? In a country like India, we still have an extremely socialistic attitude about healthcare. Is that right or wrong? I mean, I'm not going to judge that. But if you look at the healthcare economies globally, you take US is still one of the best examples, notwithstanding the fact that the cost of healthcare is just 50 times higher than what it actually should be. We actually did a study in one of the hospitals, and we found that if you need to give somebody just one tablet of Tylenol, it costs $50 in the US. Those are the kind of costs we're talking about. And in a country like India, you can do a bypass surgery. We used to say at 1/10 the cost. Now it's even less than 1/10 the cost. So these again are the great paradoxes which are happening globally. So what I'm trying to say is that there's a huge opportunity for doing it and for getting it right and being a global leader in the way healthcare is being delivered. We have challenges, and just to simplify it, I think I've broken it down to 5 challenges. One is the geographical access, which we continue to have. simply because, people do have to travel within the country for healthcare, remote locations. We don't have enough people going to the remote locations to provide healthcare, but it's a huge challenge. The second is financial access. People still don't have access to high quality and good healthcare, and that's a challenge. There's the infrastructure challenge. Infrastructure in terms of being able to build out facilities, infrastructure in terms of, literally being able to go from one place to another in a hurry, even within a city. If God forbid, there's an emergency, an ambulance cannot get there in time to help, and an ambulance may not even be able to reach a hospital in time. So, we have infrastructure issues and bottlenecks, and that's probably a big challenge. The disease burden. And this, I think, is something which, again, can have disastrous impact on our economy. The non-communicable diseases, which is, cardiac, the cancer, and diabetes. These are growing at alarming proportions. So when you're talking about a country of 1.3 billion people, and then you're saying that diseases like this, which really need, where there's a cost to care, and that is growing year on year at about 15%, we have a huge problem at hand. But where the issue is that, the awareness is not there. There is a huge lack of political will still to really look at this, access it, and try and make a difference. So, I see that as a huge challenge. The fifth challenge is the challenge of manpower. Dr. Reddy is constantly telling us, he says, you can build the most beautiful hospitals because today somebody will fund that hospital and it can be on par with some of the best in the world. You can equip it with the state-of-the-art, the best equipment available globally. That can be done because somebody will fund it. But what we cannot do is really equip the hospitals with skilled labor, with skilled manpower, because they're simply not available. We need to double the number of doctors, we need to triple the number of nurses, we need to quadruple the number of allied healthcare workers. And we don't have answers to that yet. So to me, that is probably one of the biggest challenges. So these are really the 5 challenges which Indian healthcare is being faced with. And if we want to really disrupt that dichotomy, we need to do some things about it. Some interventions are required. Some interventions should have been done literally, 20, 30 years ago. Legislation has to come into place. So I think there's a lot to do in that space. But let me tell you what is happening to really, So what is happening really to bridge this gap? There have been some phenomenal attempts made, and geographical access. Let me start with that. Our country today is the largest, can somebody just take this phone from me? Sorry, it's ringing, thank you. The geographical access, I think that is probably the most exciting, the most challenging, and the most rewarding. Today, India, including some of the best hospitals, which is, healthcare systems, which is us, which is Dr. Shetty's, Narayan Hridayalaya, Fortis, all the healthcare groups, AIMS, public sector, JIPMER, Pondicherry, public sector, CMC Velo, all these hospitals today, if you combine the telemedicine work which is happening, India is the largest telemedicine provider globally today. Every day there are about 1,000 consults happening, and I don't think anyone even knows or realizes that. So I think the geographical access willy-nilly has just been done by the healthcare providers. And it started, interestingly enough, it started with us because there was this lady with a child with a hole in her heart in my dad's village, extremely remote location. And at that time it was British Telecom who worked with the Apollo team and said, let's try this out. So we did that. And the consultation happened from that village into the city. The echo was transmitted through telemedicine at that time. Now, of course, you can get it on your telephones. Things have moved so quickly and so rapidly. The child came to Hyderabad. Surgery was done, minimally invasive. And at that time, it cost exactly 20,000 rupees. How was it funded? I will tell you about that in a second. And this thing was, showcased to Mr. Clinton when he visited India at that time. And he said, oh my gosh, this is the most wonderful thing happening in this country, and I hope it grows. And every time there's an opportunity, we tell them that today India is the largest telemedicine provider. We are providing telemedicine on a daily basis to one of the highest locations in the Himalayas, which is about lower than the Siachen border, but it's rated as the highest location in the world where telemedicine is happening. And it happens on a daily basis. So I'm saying this because it's possible. There's a Pan-African network where remote locations in Africa are getting a telemedicine consult from hospitals in India. So the villages are being connected. The IT minister was here, and he actually was very excited about the program, and we have committed that one hospital group will connect over a period of 5 years, 60,000 villages via telemedicine. There's been, what shall I say, a collaboration with ARPI, which is the body of American physicians of Indian origin, and they say that whichever location they come from, a remote village in Rajasthan or in Gujarat, that they will do consultations from their, offices. So we're finding different methodologies of using technology to really bridge this geographical gap. And I think that over a span of 10 years, with the way technology is dramatically improving lifestyles, that the geographical access will actually be overcome to a large extent. Financial access. I think, when people look at India, they still look at it as a poor country. I'm not going away from the fact that it's a country which, really needs interventions. But I don't think it's a poor country, but it's become a very smart country because of, various aspects of the government providing technology, providing, different methodologies for people, e-governance. There's so much happening. So I think it's from being a poor country, it's actually becoming a smart country. And having said that, I think financial access is something which people will get. Today, there's some government schemes which are doing extremely well. In the state of Tamil Nadu, Rajasthan is taking it up, Gujarat has it, Karnataka has it for, the farmers and the poorer community, Andhra Pradesh has it. The southern states have done a lot in providing financial access for people. But I think slowly there will be a change. And multiple schemes, there is a political will, as I said, and they call it the chief minister's schemes, but these schemes are actually providing access to people. The public sector hospitals are being upgraded, so that challenge is being overcome. How quickly can we do it? We'd like to, but it is something which is happening. Again, the infrastructure is a problem, and I said it earlier. What are we doing to overcome the infrastructure challenge? That, to me, is probably an unanswered question because, getting from one point to the other, even though roads are being built, even though people are, flying much more, the challenges of infrastructure continue to remain. And I think, with more and added focus on that, we should be able to overcome that. The fourth challenge is the manpower challenge. Today, we do not have enough medical schools. We do not train enough nurses. And even if we train enough nurses, They go away to the Gulf countries because, they're paid like 5 times, 10 times what they're paid in India. So I think the manpower challenge is huge. And unless, we are living with laws and legislations, rules and regulations which the British left. We're dealing with the British legacy. I think we need to make those changes. We need to use e-learning. We need to use simulation more. A lot of private sector units have set up simulation labs. But what has happened is that so much of time spent in a simulation lab doesn't give a student credit. So, there's a mismatch in what is being done. And I think to overcome manpower challenges, we need to really literally have a thinking transplant. We need to think differently. We need to use technology more. And to me, that it's 2 things. It's a problem, it's a challenge, but I think it's a huge business opportunity. And, I would strongly recommend that, technology to be used for learning, because all over the world it's being done. And how much can this happen in India is what we should be looking at. The burden of disease, what can be done? It's a lot about early intervention and communication. Of late, we've been running this hospital company for the past 30 plus years. And a lot of times when we sit and we look at strategy and we discuss things with Dr. Reddy, he said the only time I will tell you all that, it's a job well done is if you come back with ways and means to keep people out of hospitals. Because there is no way that even if we double the number of hospital beds in the country, can we really handle the burden of disease? And we need to look at early screening. We need to look at awareness. We need to find ways and means for people to adopt better lifestyles. Because Indians traditionally have, unfortunately, but they have narrower arteries. They are prone to diabetes and cardiac disease, and there's no going away from it. So I think for us to be conscious of the fact and try and do something is extremely important, because there is no way we can deal with the way the disease pattern is growing. And I think that is really extremely, extremely important for us. Disruption is happening, and it's happening smartly, cleverly, but it's happening in pockets. It's not really gained the proportions of a revolution. I wish it had, but these things are happening in isolation, in pockets. But if these can be used to really scale up quicker, faster, better, I think we would have made like a huge change in the way healthcare is being delivered. I think it's knowledge and it's empowerment, and the fact that healthcare is a fundamental right. It is the fundamental right of every countryman to be able to get, to afford, to access good quality healthcare. And I think that's really where we have to think differently. Many models have been coming up. Bangalore, the place for startups, disruptive thinking. So many models of, access, better quality healthcare, home care, using technology, point of care shifting from the bedside to the home, large-scale screening programs. The vans which are now going out into rural areas, which are collecting data, which are doing high-quality interventions. And then when I say data, large wealth of information, which today hasn't been collected properly, which hasn't been mined enough, which hasn't been used to be predictive. Because I think healthcare of the future is going to really be on the foundation of being preventive and predictive. It used to be prescriptive. People would just say, okay, this is the answer, this is the prescription for healthcare. It doesn't happen anymore. It has to be predictive, and it has to penetrate. It has to reach the person who actually deserves it. And I think that, again, is where we need to be disruptive in our thinking. There's so many low-cost gadgets now, the low-cost consumables. There's a company called Merrill, which now is giving literally the global companies a run for their money. They're concerned about it because they manufacture the highest quality stents, they manufacture the highest quality implants, and they're on par, they're on global standards. So look at a time where, not only India uses these products which are way below the costs of, those being manufactured in the developed world, but look at a time where they're going to be able to export it to these countries. China has done it, but I think India is not too far behind, especially in these areas. And that, again, is another opportunity, another growth area, which is so exciting for us. On the financial access, we were just chatting and brainstorming with the Planning Commission. And at that time, we said, how is it that we can, 36,000 crores was the last last budget outlay, and they probably raise it by another 10%. But we know that a lot of it is really going in salaries. There's a lot of it which is literally the wastage in the system. How can we, within the country, raise more money which can be used towards healthcare? We tried the innovative healthcare scheme, again in my dad's village as a pilot, where we said for 1 rupee a day, we could insure them and people would have access to healthcare. And then we said, let's just try and calculate and see that if we take half India's population, 1.5 billion, we'll take half of them, and then we'll use 300 days at 1 rupee a day. It's working out to 19,650 crores, which is actually more than 50% of the central budget allocation, which was 33,000 crores last year. We do have a cess for healthcare, but it's not being implemented or used well. One of the best things I think our previous government did was said that it's almost mandatory to have a CSR budget for companies. It's part of corporate governance. And I think that if we have some sort of methodology to see that we can allocate, we can raise financial resources within the system to be used for healthcare, I think again it will really be a job well done. And I'm sure that with the people advising the government on what more can be done, it will be done. I'm pretty positive about that. The pharma industry in India, again, is an industry which the whole world looks at. It's an industry which has done well. It's an industry which has flourished. But the way investments are now coming into healthcare, the provider network, the providing of healthcare, I think that as an industry now will grow because it provides jobs for people. It does lead for economic prosperity, and it keeps people well. So I'm looking at a time where, as the governments, as the rest of the world looks at IT, looks at the pharma industry, now we're talking about Make in India, which, there's so much of excitement. I'm looking at a time which will be where we can heal in India, because I think healthcare as a business, we're in the business of caring. Healthcare as a responsibility, it's something which I think every Indian has to do. And I strongly urge all of you to, I am making a pitch for healthcare because we need the best minds working on healthcare in India, and I think it's a great opportunity for advice, for intervention, for working on healthcare, because literally there's a lot to be done. There are pearls of wisdom throughout the country, but I don't think we have yet found the capability to string these pearls together and try and see what more can be done. I think for students, especially from India, of Indian origin, I can only say, the way I started, saying that it is a responsibility. It's a responsibility because it's a growing nation. It's a responsibility because unless people feel empowered to come and make a difference, we may not be able to see the kind of progress which India deserves. And I personally have grown up in a family where we're extremely proud to be Indians, despite the fact that, there is the politics of India, the chaos of India, the disruption of India. There's still a lot to be done, because I think every Indian deserves a better life. And for those of you who have spent time hearing me, I would say that the biggest gift you can give yourselves is to spend some time thinking about, it's very hard to say that everybody pack up your bags, move back to India and do something. But if you can spend some time trying to see how can we really disrupt the way things are being done in India, how can we bridge the dichotomy, how can we bridge the paradoxes which are happening in India, using the best minds, using technology, using financial access, using the mind power, using the energy which you all have, the young energy, I think we can make a huge difference. I'm delighted to be here with all of you, and I think, HBS, the mind power of the US, the excitement of US will always contribute to making the rest of the world a better place to live in, and I'm looking forward to that to a large extent. I'm going to spend, I have time for questions and answers, because I think that would really make it more meaningful and exciting for all of you. So please feel free, and I will try my best to answer all your questions to the best of my knowledge. Thank you.
If you have... Sure, go ahead. If you have questions, please step forward down the stairs to the mics. Thanks.
Dr. Reddy, thank you for a wonderful conversation on the healthcare environment in India today. My name is Atul Pava. I am a healthcare strategy and business model consultant. Since 2011, I've had the privilege of working at the University Hospital in Geneva in Switzerland, setting up a state-of-the-art training center and research facility, which over time should become the European hub for neurosurgery. You talked about political will, you talked about some of the issues and with the Planning Commission and more. Made me think of our experiences, and I thought I would maybe make a comment and maybe ask a question at the same time. We raised millions for our effort. We got the entire healthcare, medical device industry involved. We, of course, got the surgeons and the thousands. This was 5 years ago. Today, we are running 3 years behind schedule with no launch date in mind, primarily because of the bureaucracy. One of the things that we realized, even with Switzerland's progressive healthcare environment, and everybody from President Obama and more talk about it as being a beacon and a system to look up to, there were no project sponsors or people in the bureaucracy or the government who would make those smart, big, bold moves to move the roadblocks from around our efforts. And my question for you is, do such people exist in the healthcare ministry today who understand that as people like you are doing the best that you can, and these are probably, like you said, incremental changes, even by doubling the size of the beds, there's only so much you can do. But is the healthcare ministry looking at initiatives that will actually accelerate the healthcare reform in the country?
I think it's a good question, and I will answer that in two parts. If the question is that, is there political will to do it? I think the new government has really put a lot of things in place for, some of the other sectors. Honestly, they haven't addressed healthcare yet, because maybe in the list of priorities, healthcare hasn't been, the highest. And frankly, IT is cool, is exciting. Make in India has to be done. So there are a lot of initiatives, and I strongly think that it will happen. There is political will. I know the Department of Science and Technology, because I work with them. Clearing things is much faster. If you want to, run a trial or a pilot on, some of the newer and devices being done, clearances are coming much faster. We are setting up a proton center, in Tamil Nadu, and I was pleasantly surprised that the support from just to get all the licenses, because this needs some 50, 60 licenses before you even break ground, came very, very quickly. So I think the political will is there. We have, Chanda is sitting here, and I really admire the way I have to say this because, Chanda is here. Our hospital in Hyderabad, there was a time when Apollo was almost going to go under. We couldn't really pay our debt, and we couldn't pay the banks. It was ICICI which bailed us out. So I think the financial support, the financial interventions is also there. Private equity, private banks, public banks, that is there. And you will see that there's so many people investing into healthcare. So the change will be there. Will it be like, Singapore or Switzerland or the US? I'm not sure, because in these countries, somebody else is paying for healthcare. The governments are paying for healthcare. India cannot afford to pay for 100% of Indians' healthcare. So we need to come up with models. We need to come up with formula which is, different and more contemporary, for example. So that's the way it is. Can that mic be raised a little? It's a little hard to hear from that. Or you'll have to speak right into the mic.
Sure.
That one is a little hard.
Could I request you guys to please keep the questions a little bit short? We want to take as many as possible. Don't have much time. Thanks.
Hi, I'm Keerthana. I'm a healthcare consultant with Deloitte here. So my question for you is, you spoke about shortage of workforce in the healthcare industry in terms of doctors, nurses, and allied health. We all know how difficult it is for a student who's just finished 12th standard to get an MBBS seat because of the high cutoff, and to top it all, the reservation that comes in terms of the caste and not the economic status of the student. So, and I'm a med school dropout just for the same reasons. So, is the government or a private sector hospital like yours doing anything to tackle and target students from high schools? And that's my question for you.
I think, honestly speaking, a lot of private sector companies like us are not doing it exactly the way you're asking, but why are people not able to get into colleges? Why is there reservation? Simply because there's scarcity. You cannot start a medical school unless you have a couple of 100 crores. You cannot start like a good high school unless you have, that kind of money. And then the fee structure becomes regulated. So people are really not getting into education the way they want to. And then it's based on philanthropy. So I think we need to change the model and understand that, education has to be there. The cost cannot be at a level where, people are making insane profits out of it. That should be regulated. But I think the fee structure and the way the fees are really structured has to be done more pragmatically, that, it's sustainable. You can't sustain quality education unless, you pay for it. But I don't think it should be based on caste at all, because it has to be equal opportunity for all, and the brightest and the best have to be given an opportunity, and I think that's probably what should be done.
Thank you.
Okay.
Great lecture, Preetha ji. I had a question on the financial access that you mentioned. What are some of your suggestions to improve financial access so healthcare becomes more affordable?
Sorry, did you say how do we make financial access more affordable?
Correct.
Strangely enough, the private sector insurance is doing very well in India. It's growing at about 30%. And there are more global players coming in and for health insurance. So I think that is one stream where, if people really take on more insurance, they should be able to pay. Then there's the government insurance, which they do for people. Different formula are now being done. As I said in my talk a little earlier, the southern states are really able to reinsure the healthcare bills for their people. And, so the large public sector insurance companies are reinsuring the state insurance program. So people are finding financial access from that. But if people are encouraged to really, invest, literally, if the cell phone penetration in India is almost close to 1 billion, why can't we find a way to really use that to say 1 rupee a day should be put aside for healthcare? Because, those are the people where we have a responsibility to provide healthcare for. So I think it needs a little bit of thinking through. It needs 10 years down the road. I'm so confident that at least 70% of our people are going to be able to afford some kind of healthcare or the other. So the financial access, we may be able to bridge that gap. But the infrastructure access, I think, is a huge challenge. The manpower access is a huge challenge, and we need to find answers to be able to do that. Financial access is not such a big problem anymore.
Thank you.
This is Rahul Mehra. I just have a question on a topic that you touched upon, which is disease burden. As you well know, India has the highest disease burden of any country in the world. If you look at the model of what happened in the Western world, half the disease burden was reduced by preventative measures and half the disease burden was reduced by treatment measures. And I know Apollo hospitals and Fortis are in the business of doing treatment. My question to you is, what are you in Apollo and the country at large doing to reduce the disease burden by prevention of diseases? That is much more cost effective, as you well know, but there is no focus that I see in the country on prevention and health promotion.
Thank you for asking that, because if you hadn't at the end of it, I would have said this myself. And I'm talking only about what Apollo is doing, and I'm hoping many others would do something very similar. We started a program which was, we used a name called Billion Hearts Beating. It might sound a little silly, but sometimes when you name something which is slightly ridiculous, people start looking at it. And in this program, it creates awareness. It just tells people that you need to do a few simple things: adopt a better lifestyle, do yoga, don't stress, quit smoking, eat better, and adopt better lifestyles. And there is data to show that if you make these lifestyle changes, it really makes a huge difference. And then you extrapolate it with the economic impact of it, and it's going to be huge. So I think we've done that, and it's not enough in a country of, again, as I said, 1.3 billion people, but we've managed to at least touch, which means, people responding, coming back, asking us questions. We've done 10 million. I'm not sure if that's big enough, but at least it's a start. The second thing which we've done is, in my dad's village, because I think this was it was a very emotional thing and it was a primary responsibility, but we've adopted 60,000 people to do a pilot project, what we call Total Health. So we talk to them, it's literally from cradle to grave. From the time a child is born, we talk about nutrition. We run a school. The school is by, the Isha Foundation, which is Sadhguru Jaggi Vasudev's, because then it gives them a very philosophical attitude on education. So we do that. And while we are doing all this for the whole village, we talk to them about these 5 things. We talk to them about better lifestyle, about nutrition, early screening program, because, women with cervical cancer, huge problem in India. We're trying to work with the National Cancer Institute in the US trying to see if, we can really vaccinate them against cervical cancer. So the different things which are happening, but the Aragonda Total Health Program is now something which, the WHO is looking at to see can be replicated. Because I think an organization can do one program and do it well. Can the model be replicated throughout is what would be exciting for us. It's about 3-4 years old, and it's made a huge difference. And we're researching outcomes on that, using the data for analytics and seeing how we can make it better.
We have time for one last short question, please.
Dr. Reddy, excellent, very nice talk and answers. I just have a question follow-up on that. Many Indian cities are in top 10 among the most polluted cities in the world, and of course that has health consequences. So can you elaborate on what are the measures, or what is the health impact, and what are the measures that are being taken? Thank you.
That's a scary one, because there's so much about Delhi happening, and them trying to see how do we make it pollution-free. Honestly enough, the level of consciousness about pollution, the level of consciousness about addressing it, people realizing that it's their responsibility to look at a greener, cleaner environment is not there enough. So if we can do something about it, it would be nice, but I don't have an answer. We're not doing enough. As a country, we're not doing enough, and there are just so many challenges that this hasn't become a priority till, Delhi just hit the media.
Okay.
We can, for the questions I didn't answer, please feel free to send me an email, and I will make my best attempt to do it. It's quite easy. It's Preetha Reddy at apollohospitals.com. Thank you.